New Hampshire's economy is absolutely booming because we've allowed businesses to compete, we've lowered their taxes, we've gone through regulatory reform. When you arbitrarily double the minimum wage, it could have devastating effects on a small business. We have some of the highest wage growth in the country because we do it right. The model here really works, and having the government mandate a doubling of the minimum wage could be really devastating to especially the small businesses across the state.
Today we default to the federal minimum wage of $7.25, and that is not a livable wage for the people here in New Hampshire. So as governor, I would pass legislation, sign into law, a minimum wage that would move up to $15 an hour gradually over a 3 to 5 year period, and work with our businesses, our small businesses, to make sure that the minimum wage bill works for everybody. Families do need support when they are caring for their elderly parents or for members of their families with disabilities. As governor, I will sign into law paid family medical leave, which allows workers to be with the people they love the most when they're needed the most. Also, we need to support the caregivers, grandparents, foster parents who are caring for our most vulnerable children today, who are truly the victims of the opiate epidemic.
Supporting family caregivers is vital to keeping that New Hampshire advantage. You do it through a couple ways. Number one, we've raised the actual rates that we can pay nurses for in-home care, where people have the dignity of staying at home, they have better quality of care at lower cost, and allowing family members to come in and be part of that program is absolutely vital. When you look at the direct service professionals for the DD community, again, we're looking to raise those rates and making sure that given our economy, the strength of our economy, the wage growth we've seen in the private sector, the public sector has to step up and be sure to match and be able to compete with those wages to allow family to stay in homes and work one-on-one. And that's just how we're going to get the best quality of care. Through 2016, fighting the opioid crisis, there was really no structure here in the state. We've taken a whole new approach to it. We've introduced our new hub and spoke model, which provides rural access to care, wraparound services. We have our new recovery-friendly workplace programs that are coming online, allowing employers to be part of the solution. We have the only youth treatment center in the state that is just opening up right in Manchester, providing opportunities for adolescents and youth. So we're taking a very new approach, a whole new structure for the long term, and we're going to finally start seeing some real results on fighting the opioid crisis.
I support evidence-based models that are successful and support training and education for our recovery coaches. You know, drug courts are working, they're finding success, and they're finding success because they keep families together. As your governor, I would implement a comprehensive plan that does address and treat this opiate epidemic, as we would any other medical epidemic here in our state. You know, I have 4 children and 7 grandchildren. When my 4 children went to school, I never worried that they would be affected by gun violence when they walked into that school door. Today, I worry about my 7 grandchildren every single day. So we must do something about keeping our schools safe. As governor, I will make sure that we do pass universal background checks, keep guns out of the hands of children and domestic abusers as well.
You know, speaking on the issue of violence in schools, I kind of take the governor's hat off and just wear my dad hat. With children in both elementary and middle school, it's something we take incredibly seriously. Before my administration came along, the state had never put a single dollar into safe school infrastructure. We invested $30 million to over 400 public schools across the state, making sure they had the resources they needed to provide a safe environment for their kids. You match that with the Safe School Task Force report that we put together, recommendations across the state dealing everything with communications, undiagnosed mental health issues, wraparound services for kids. We're really taking a national lead in this issue. I've been one of the most progressive governors in the history of New Hampshire when it comes to marijuana reform. We went through decriminalization, making sure our penalties and laws were in line with other states. We've expanded the use of marijuana for medical purposes. But when you're in one of the most significant public health crises the state has ever seen with opioid addiction, now is simply not the right time for full-blown recreational marijuana.
I do support legalizing marijuana, regulating it as well, and taxing it. As governor, I will build a New Hampshire that works for everyone. Education has always been my priority, and instead of giving tax breaks to the wealthiest corporations, we'll invest in education, job training, and making college affordable. And also, families are crying out for paid family medical leave. We know how important that is to working families today. And as governor, I will make paid family medical leave a reality.
We're supporting families across the state by focusing on the economy, making sure that business is thriving, that employees have opportunities. We've seen some of the highest wage growth in the country in just the past 12 months. We have the lowest poverty rate in the country, one of the lowest unemployment rates. Everyone has an opportunity to succeed. We have 20,000 available jobs, more people working than ever before. This all creates opportunity and income for individual families across this state, and we're going to keep it going.